Did you know there's a deformity that makes your arm look like a gun? Make sure to watch.
The carrying angle is the angle between the humerus and the forearm, and typically it's between 5 and 15 degrees.
If the carrying angle is less than 5 degrees, this is known as a Cubitus Varus deformity or a Gunstock deformity, which means that your forearm is now more medially placed. It's called the Gunstock deformity because it resembles the gunstock of a long rifle. Here at the Bone Museum, we have 2 specimens on display with this condition, so let's learn more about it. The most common cause of this condition is a supracondylar fracture, which is when your distal humerus fractures above the epicondyles. This kind of fracture is extremely common, especially among children, and it typically occurs when someone falls and catches themselves on their extended arms. Typically with this fracture, the fragment is displaced. It's moved posteriorly, it's going to internally rotate, and it's going to move up on the medial aspect. And if it heals in this position, that's when we have a loss of the carrying angle. Now let me help you better visualize this. As you can see, the one that was fractured, it's much more angled on the distal end than the one that does not have a fracture. Here's another specimen we have on display at the Bone Museum with this Gunstock deformity. However, this one also has the radius and the ulna attached to it. This arm is now fully extended. However, you can see with this deformity that the forearm is placed more to the midline. You can see the exaggerated angle right here. This condition doesn't typically result in any loss of function. However, in extreme cases, it might, in which case an osteotomy can be performed to correct the bone. While supracondylar fractures are the most common reason for this kind of deformity, other reasons might include abnormal development, osteonecrosis, infection, or cancer in the region. Hi, Bon Jovi! This is also referred to as a malunion fracture as an overarching term. This is when the bone breaks and then heals in a misalignment. So that's a little bit more about Cubitus Varus or the Gunstock deformity. Make sure to like and follow the Bone Museum for more content.